Hello, this is Brian Casey of Casey Insights, and we are here at the JP Morgan Healthcare Conference in San Francisco. We are here with Lior Eshel. He is CEO of TestDynamics, and they are developing an artificial intelligence ecosystem that he's talking to investors and other people here in San Francisco about. Lior, thanks for being with us.
Thanks for inviting me, Brian.
Sure. So, Lior, artificial intelligence is a really big story in radiology right now and throughout healthcare. But you guys are taking a slightly different approach. Can you talk about that a little bit?
Yeah, so we are starting off about a few years ago, and we saw the challenges in radiology. The challenges are there is a huge burnout and shortage of radiologists all around the states, and another problem is that the numbers are increasing over time. So eventually,
numbers of scans and things like
that.
that.
Yeah, the number of scans. So eventually, you have a very big gap between and a big backlog of creating this diagnose these cases.
Yeah.
And then sometimes it takes time to diagnose cases, and sometimes you miss or you have errors. So when my dad diagnosed with cancer, we had to go to many scans, be it PET CT, MR, and CT, and eventually one of the PET CT came with an error. It mentioned that he has suspicious PE, pulmonary embolism, which he didn't have. So we had to go into another scan, and the radiologist said, it's just a pneumonia. So eventually, radiologists are the gatekeeper for any kind of disease, any kind of clinical care pathway for the patient. And if they make a mistake and they have no time and pressure, then it's affect the patient eventually. So that's exactly what triggered me to come to the market and understand more about radiologists. And I talked to so many physicians and radiologists all around the globe. And eventually I understood that, they do a great job, but eventually they have no time and pressure, and they need kind of technology to overcome this gap, and technology is basically AI and computer vision, right?
Sure. Yep.
So when I research the market and I talk to some AI companies, that develop algorithms, they build a very great technology, but how do you facilitate in your institution? How do you connect all these hundreds of AI models into
there's dozens and dozens of them.
And you see it in RSNA, right?
It's
like it become bigger and bigger every year.
Yeah.
So the problem is that we want to standardize in a way that you connect these AI models in one platform, basically, in one user interface and single integration. So we can facilitate all these AI models in a very nice way for radiologists just to use it without knowing which AI is running in the background, but only one user interface to deal with the interpretation.
Because that's what the radiologists really care about, right? They don't necessarily want to use a particular algorithm. They want to solve a clinical challenge that they have.
Yeah, exactly. So they don't care about the way of integration, the user interface. They just need something that would be very easy to use, like an iOS, like iPhone, right?
Yeah.
Very easy to use. Nightmare for the developers, but it's heaven for the user. So that's what we're trying to build with this platform.
Great. So this is something that's vendor agnostic. It's algorithm agnostic. You can bring in algorithms from a lot of different companies.
Yeah, we designed to be a platform from the get-go. So we don't compete these AI companies. We don't develop the AI models. We just facilitate that.
Yeah.
So it's an unbiased and neutral platform, and we want to be independent in a way that we can integrate with any PAC systems and any radiologist with. Eventually, our focus is more about the user interface and the workflows.
Yeah.
So we want to build nice workflows. We want to understand the technology of these AI algorithm companies and basically fit it into the right workflow. So try to fix the maze, in this space.
Now, are you going out and talking to AI algorithm developers to bring them into the ecosystem, or are they coming to you?
So it goes both ways. So at the beginning, we start talking to AI vendors, and all of them was very excited about that because they have no access to the market. 90% of them are not selling in the U.S. market, and eventually they need someone like with a bigger umbrella to sell them through the U.S. market. So obviously, most of the AI vendors will go to platforms, not just us, but others also. So that's a better approach for the institution and hospital.
Okay.
Just use one single integration.
That makes sense.
Platform.
Now, you guys are here at a satellite conference to JP Morgan. What are you talking about here?
Yeah, so we are meeting investors and hospital administrators. We are part of the CICC, California Israel Chamber of Commerce lounge, which is a satellite lounge here in the JP Morgan conference. And lots of meetings, lots of events.
All right, good luck. Well, hope everything goes well. Hope you guys are able to to get some funding and get some interest. Now, when do you think we'll see an actual commercial product on the market?
We anticipate to be commercialized by Q3, Q4
Of this year,
of this year.
2023,
We're running
yeah.
some pilots right now, so we're testing the environment, and eventually we want to be live pretty soon.
Very good. Well, Lior, good luck, and thanks for being with us.
Thank you very much. Thank you for
right.
having me.
Signing off for KC Insights, my name is Brian Casey.